A little longer for them to know their fate since their DNA results are not yet out. Ruth Wamboi reporting for Prime Edition from Kahawa Law Courts in the county of Kiambu.
Now, the hurdle of getting a viable donor for organ transplant and coupled rather with the prohibitive costs involved that have been identified as the major challenges that face patients who are in dire need of transplant services. In Kenya, for example, there is no organ bank, and patients solely rely on blood relatives who are alive. Now, with the shrinking family settings, getting a donor is proving to be a challenge. Experts are now calling on people to develop a culture of organ donation. Why? So as to fill that gap. Here's that report.
John Gikonyo counts himself lucky after a successful kidney transplant 8 years ago, an organ donated to him by his sister. He was diagnosed with a kidney disease in the year 2009 and had his transplant in 2015. Luckily, by the time of diagnosis, his condition has not reached kidney failure. He was forced to explore several avenues of treatment prior to the transplant, which he says was financially constraining.
The other challenge is finances for getting a transplant, and the other challenge is post-transplant care, the care after transplant, because you need to take medication for life to suppress your immunity so that you protect the new organ, which your body will recognize as a foreign body. You need regular clinics at least every 3 months, and the clinics require laboratory tests, and all these are expensive and they come at a cost that a lot of people find it's too much for them.
As Kenya joins the world in commemorating the World Transplant Day under the theme Hope for Tomorrow, transforming lives through organ donations, stakeholders in the medical field who convened at Kenyatta National Hospital to mark the day urged Kenyans to embrace organ donation to save lives. The medical experts noted that the Ministry of Health and the government have taken steps to ensure that such services are readily available when needed.
It's not only the preventive and the basic services that we are looking at the specialized care that Kenyans will need. And when they need, it should be available to them. And we are looking at the costs, the affordability, the quality and availability. So access has those three components.
Improved infrastructure, training of more human resource, formulation of policies, procedures and regulations are among the key issues that, if prioritized, will turn around the health sector.
We want to protect the donor, we want to protect the recipients, so that we have enough organs and tissues to all the patients who need these organs and tissues, because this will help us to expand the space so that organ transplant becomes accessible.
The issue of access, the issue of quality and the issue of cost are very key. Now, when it comes to costing, we still find that many Kenyans still cannot afford to get transplantation, but this is because many of them will have to, there are conflicting interests, financial interests.
The World Transplant Day is marked every 6th of June, drawing attention to people who live with transplanted organs or waiting for transplantation. Genetic conditions such as polycystic kidney disease and heart failure are the main causes of organ transplants. As Kenya joins the world in commemorating the World Transplant Day, Kenyans have been urged to develop a culture of organ donation in order to save lives. This as the government puts stringent measures to curb animal practices. Michael Mandiga from Kenyatta National Hospital, Nairobi.
Well, ahead of the World Population Day coming up in a couple of days tonight, we are privileged to host William Ryerson, the President of the Population